the Pentamed, which has been dealing with that crisis. So, Kirti, we spoke about two hospitals and we have been talking about that since morning, Fortis and Pentamed. Give us a quick update on what's the situation there.
Yes, we are at Pentamed Hospital in Model Town area of Delhi. We've been here since 11 a.m. and the oxygen supplies here have been diminishing. I have with me again the CMO of the hospital, Dr. Haider, and we'll speak to him about the situation real time as of this moment. Sir, how much oxygen do you have left? What is your appeal to the government officials that could be watching this right now?
Sir, ma'am, we are left only with 45 minutes, approximately 45 minutes of oxygen. We have appealed everybody, almost all the government organizations, but we are not getting the required oxygen. We have a requirement of approximately 100 to 150 cylinders per day, but what we are getting is 20-25 cylinders. That's all. I mean, through your platform, I would like to request all the whoever are listening this that please help us in this regard. Otherwise, it will be a big mess. I can't tell in words. We won't be able to save our patients.
How many patients in the ICU and how many in total?
In total, we have approximately 50 patients right now in our hospital. Out of those, 10 are on ventilatory support and around 10 to 15 have high oxygen demand. So they will have a lot of problem if we don't provide them sufficient oxygen in the next few hours.
So the government claims that there are nodal officers that were made for this entire oxygen coordination system. Many of the Delhi government officials have helplines. Or have you been in touch with them?
Exactly, ma'am. It's been going on since last 3-4 days. We have been trying to contact them, but they are not meeting the demands. I mean, we asked them for like 50 cylinders. They only provide 5 or 10, which is not sufficient. That's where the problem is. That's why we are running from pillar to post and we are not getting the required oxygen that we need.
Thank you, sir. Thank you so much for talking to us. So that is what the doctors here have to say as of this moment, but many other relatives of patients who've tried to arrange oxygen cylinders on their own as well and have faced this crisis. We spoke to them earlier as well, and this was the situation when we spoke to these relatives of these patients.
All right, we'll try and bring you that report in just a bit. Thanks to Kirti for joining us for the very latest.